Coming to you from Beaumont, this is your house call.
My aunt and uncle married of 40 years, both contracted COVID. My uncle actually passed of COVID, and my aunt, no matter what we said, did not want to be vaccinated.
I had a patient that I was consulted to see in the emergency room in Dearborn. Elderly woman. She's Arabic from Dearborn. She was actually a Syrian refugee. And when I asked her if she was vaccinated, she said no. She was short of breath and requiring a lot of oxygen in order to breathe. She told me that she didn't want to take the vaccine because her daughter told her to wait because they will know more about the vaccine later. So she didn't take the vaccine at that time.
I have a patient that I saw the first time. He is originally from Puerto Rico. He's here with his family. They didn't want to have vaccination. Unfortunately, all of them were high-risk patients. All of them got the virus and they were in critical condition. He's the only survivor. After he recovered, he said he was going to have the vaccination. He's actually an advocate to talk to people about what happened to him and to convince others that that was the right option to do, having the vaccination.
Hello and welcome to the Beaumont HouseCall podcast. I'm Dr. Asha Shahjahan. Our goal is to help you and your family live smarter and healthier lives. Today we're talking about vaccine hesitancy, particularly in the Black, Hispanic, and Arabic communities. Joining us for this is Mo Menard, Director of Nursing at Beaumont Farmington Hills, Dr. Hanandi Das, an infectious disease specialist and Director of Infection Prevention at Beaumont Dearborn, and Dr. Alfredo Navarro, an internal medicine provider at Beaumont Health. Thank you all so much for being with us today. As the Delta variant continues to spread across the country, infection rates are increasing, especially for people who are not vaccinated. Blacks and Hispanics still remain less likely to receive the vaccine compared to other communities, leaving them more vulnerable. Here in Michigan, we see similar with the Arab American population. We know this virus disproportionately impacts people of color, and building vaccine confidence will help reduce health disparities going forward. Vaccine hesitancy is a huge problem, and today our guest can help us unpack why. So Mo, I'm so glad that you're here today. We've worked together on a lot of vaccine initiatives, so I'm excited to have you talk a little bit more. But as I mentioned earlier on, and we've talked about this ourselves, is that Black adults contract COVID-19 at the same rate as white adults, but they're twice as likely to die from the disease. Oh, yeah. And yet many Black people are still really hesitant to get the shot. And with the Delta variant spreading, it's becoming more of a concern. So can you tell me from your experience as you're a member of the Black community, why is it that people are still hesitant?
Oh, thank you so much for having me. I enjoy any time I get to talk about the vaccine hesitancy. It's interesting because just early this morning, I had another group of actually employees that I, spoke with about the vaccine hesitancy, and the majority of the group was African American. And it amazes me, the myths that are constantly repeated. The trust in the medical community among African Americans is, there really aren't any words to describe. So we still can't stop talking about the Tuskegee experiment when you even try to explain to people that it wasn't that they gave them something, they didn't give them something. When you try to explain, how all that went down, there's stories that have been passed from friend to friend and family member to family member. And social media has now become to be what we are stating as fact. The hesitancy that you hear over and over again, really, and just the information and feedback I'm getting from the groups that I'm talking to is from that mistrust in the medical community, believing that even as far as that we are being injected with microchips so that we can be monitored. And, it's so sad because I say, do you have a cell phone? You be like, we can find you anyway with a cell phone,
Yeah.
right? To me right now, there is not enough footwork being done around the busting of the myths. Like, it would be wonderful if we had soldiers on the ground just myth busting with facts all day long.
So Mo, it sounds like you're saying it's really a lot to do with mistrust and then also misinformation. And we'll get into that a little bit more.
Yeah, absolutely.
And I'm definitely, like, when we get this army of misinformation busters, I'm recruiting you to join me on the line.
Oh, so listen, I will be your number one myth buster. I just had an employee ask me, and this was the first time I ever got this question. She asked me, why are you all making me take all 3 vaccines? Why do I have to take the Johnson & Johnson, the Pfizer, and the Moderna? I said, oh my God, you don't. But see, I'm glad she asked that, because in her mind, if she had this information that she was getting, misinformation, she was under the impression she had to take all 3 vaccines. So yes, I will definitely be on your myth busting task force.
Dr. Das, what are you seeing in your community, in the Arab American community?
The Arab American community is very closely related to the African American other minority groups, and so it's more about the social media and who they follow on YouTube or other social media venues and what kind of information they are presented with. And for some people, those YouTubers are easier to follow, easier to understand, even if they present the wrong information, but it's easier to repeat and digest. So you see a lot of similar myths that Mo was talking about, that those are tracking devices, not vaccines. They cite the rapidity of the approval, the emergency use approval of the mRNA vaccines, and they suspect that this is due to another goal other than protecting the communities from COVID-19. You see a lot of rumors circulating, especially among the young females, about fertility concerns over taking an mRNA vaccine. And those also stem from social media and the amount of information that they are presented with, and they find quite accessible. And they have access to people who are celebrities on those places. They have more followers than the combined healthcare systems in all of Michigan. And those millions of people, give the power and some credibility to the false claims they have over social media. And that's what's really getting to the Arab American community, unfortunately.
Yeah, so it sounds like a lot of the same, but also what I like that you mentioned was health literacy being an issue. So if you are a physician and you're giving information, but your information is not digestible, people are going to sources that are a lot more simple to understand. And a lot of times they may not be the most reputable sources. So like I said, we'll get into it a little bit more, what all of you have said, but I want to hear from Dr. Navarro to kind of talk about what are you seeing in the Latino community?
I believe that there's so many misinformation that are out there. Unfortunately, it's been happening for a little bit of time. When the vaccinations came back, there is something that I always remember, and is that the majority of the people who were vaccinated were mostly Caucasian. And it was a common belief, especially my patients, that it was more offered to them than to the rest of the population, especially minorities. But then you come with a diverse thought process that many people will have. I have patients who, let's talk about basically Hispanic population, Spain, Latin America in general. We are going to see that there's a culture for some population, especially South American, where they believe that vaccination is a must. And they were very welcoming to that, but they couldn't find the vaccination available in many places, which is, the story has changed, as you all know. Now it's more available, so it's just a matter to go there. Then you go to South America, to Central American and Mexican, and there's a little hesitancy. But remember that also a strong population, a big population of Hispanic American who were born here in the USA. Minorities have been taken for granted in this kind of health approach, and especially being able to find themselves into a better health providing system compared to other populations. So I would say that based on what I've been finding, some of the people, yes, have been misinformed, and some of them have been telling that they prefer to wait a little longer to have the vaccination, when my intention to them, the information that I give them, is that this is a vaccination that have been in process for a long period of time. I want to say 2002, when we first heard about the SARS, which we can call it SARS-1, and research that were done since then to try to bring a vaccination after. And also the technology from 1960s and beyond, which is the Johnson & Johnson. So there are alternatives when people feel that they are hesitant, and I would say that it's mostly misinformation what have done that fewer people have the vaccination by this time.
I like that you mentioned a little bit about vaccine equity and access, and the fact that in some communities, vaccine access didn't really become available until just now. And that's why we might be seeing fewer numbers of people getting vaccinated in minority communities. So it looks like mistrust is like a big deal. Misinformation is a big deal. And then just barriers in general of vaccine access, or maybe even technology barriers. We didn't really talk about that, but I noticed, especially in the beginning, in order to make an appointment, you need to have adequate resources to be able to do that in terms of technology and being able to navigate online. And I know for a lot of geriatric patients, that was a difficult thing. They had to have people help them in order to do that. But so with that summary there, since we talked about mistrust, and I'll just open it to whoever wants to answer, is how do we build better trust in our healthcare communities? Because if we're not trusting the experts, we're not trusting the doctors and the providers that work in healthcare, that have studied healthcare, that understand medicine, and instead we're relying on celebrities who have no medical background whatsoever, I mean, we're in big trouble. So what do you think? What would help improve some of that?
You know, one thing that just stands out for me, like repeatedly, is truly, in order to break that barrier down with mistrust, is being culturally aware and knowing your audience that you're serving. That makes people feel so much better when they can connect with the person giving the information.
So like really being able to talk to people where they're at, making sure that we're sensitive to health literacy. And I think Dr. Das, you kind of alluded to that earlier about people following social media stars, because they speak the language that people understand. In healthcare, we have been working a little bit more in trying to get implicit bias training, cultural dexterity training, helping people really understand different communities, because we're all from different places and we all have different ideologies and backgrounds, but being able to just relate to people, I think, is a huge thing. Dr. Das.
Yeah, I think I agree totally with Mo said, and I think diversity in healthcare workers brings something to the table, because from people from different backgrounds possess the natural ability to communicate with different groups of people at a better level. And I think leaders from within those communities, who could be healthcare workers and could be essentially different kind of professions, whether religious or other backgrounds, can contribute so much to bringing people closer to the truth and to see the big picture and the benefits of the healthcare interventions in general, and specifically the vaccines. Although the vaccines may have another layer of misconceptions, and even among the more educated. Actually, just recently, the National Arab American Physician Association did a survey among physicians and healthcare workers who are Arabic and live in the United States, and found that there is a big percentage of vaccine hesitancy, although those are people who are educated enough to go to the right resources, but they were still hesitant to take the vaccine. And some of them repeated what the non-medical or non-professional people were saying about the vaccine side effects or the improper use of the COVID-19 vaccine. So there's definitely another layer when it comes to the vaccination that has to be taken care of.
Dr. Navarro, what do you think?
I think that the most important thing to go through is for creating trust. And trust, it cannot be built in 1-2 days. It takes time. I give you a short story. I'm originally from Venezuela. And after you finish the medical school, you have to go away from the big cities. And you find terrific people, very humble, and with level of education can be diverse. And I remember that some of the people were walking in the clinic barefoot and not shirt. And so you begin to create the trust. At the beginning, you don't tell anything, obviously, but then you tell them how many diseases you can have just walking barefoot in the street or being without the right cover. It rains, et cetera, et cetera. I feel the same way here. I feel that I've been practicing for 21 years, and I feel that it always takes time because you're going to always meet new individuals, and we're going to meet individuals who have a degree of education and may think exactly the same as anybody else. And I feel that when we build that trust and they can follow information that is not coming from the TV, but is coming from the right sources, we can convince people that the correct thought processing should be the right choice to take the decision and have the right vaccination.
Yeah, I love that you say that. All of the things that you guys said are just fantastic because I think, for healthcare systems that are looking at how do we improve vaccination rates, it's like looking at the big picture, hiring a diverse workforce. Like you said, Dr. Das, is so important because you're more likely to trust someone that's from your community that looks like you, speaks like you, can speak your language, et cetera. And then also, Dr. Navarro, as you mentioned, I think being able to spend time with people from different cultures, understanding where people are coming from rather than just judging, it's spending time in communities that are different than your own. I think that will also helps a lot in terms of understanding other communities and then also building trust between the community and yourself. So as a provider, I think that's an important thing to know to do. What's the best way to approach your community when having a vaccine conversation? What do you find works best?
I explained to them that my goal, right, I am vaccinated and I share my own story of having comorbidities. And even though mentally I believe that I could beat COVID, physically I know I can't. I have high blood pressure, I've had blood clots in my lungs. So I share all that with them. And then I tell them, I am not here to force you to get the vaccination. I am here to help you make an informed decision. So just starting it off like that to assure them that I'm not going to force them to get the vaccination. And then we jump into myth busting. I've got a lot of engagement and have been able to change a few people's minds. When I'm talking to them about researching the information, I do explain to them that when you take the time to research, I'm not telling you to do it in a day. It's not going to take you a day to get through the emergency use trials if you go try to look them up. It might take you a couple of days, but allow yourself that opportunity to fact find for yourself.
Yeah, I love that empowerment model. And it's like you're trying to help work together with people. I think when we come at people with judgment or even with the notion that I'm here to change your mind, it doesn't go well, right? People get defensive. Nobody wants to have their minds changed, but just having an open dialogue to answer questions and like maybe debunking some myths can open dialogue like you mentioned. Mo, I do have a question. So that story that you mentioned in the beginning, did she end up taking the vaccine or not?
Yes, my aunt did end up getting the vaccine after a very, she's tough cookie. This woman was a very tough cookie. I did not think she was going to change her mind. And I'm like, hello, ma'am, you have comorbidities. I had to remind her, and my mom reminded, and our other family members, and then her primary care doctor, do you think you, with your own health issues, can box up against COVID? Just convincing her, it took a lot of discussion. But I think what really finally hit her was when my mom went and got vaccinated. And then our other aunt, and I think that's when she said, okay, my sister's going, I think I better do it, but she drove her primary care doctor. He has the patience of, I'm telling you, because she was the question, she wouldn't stop, which is a good thing,
Right. Yeah. So I'm glad she got her questions answered and, was also inspired by a family member. So I think that's great. Dr. Das, what's the best way to approach the Arab American community in your experience?
Many of the things that Mo mentioned apply also to the Arab American community, including starting the conversation, allowing questions to come, and having the resources ready, easy to read resources, so they can provide, in the case of the Arab American, for example, finding resources in Arabic. But it's also important to remember that the Arab American home is a multi-generational home. And oftentimes the decision makers, not just from physical or financial needs, usually the person who also convinces the rest of the family to make healthcare decisions are those who are younger, who have access to media resources, who have access to their community in general, who have those conversations with others outside the household. Those are the ones who influence the decisions of the rest of the house. So in order to be able to achieve good results in those communities, you have to design conversations that are fit for different generations. So not just focusing on social media, for example, but also focusing on some written communication, person-to-person conversations, allowing the elderly to be heard, also to hear their concerns and their barriers, what they perceive as a barrier to getting vaccinated. Sometimes I had a patient who thought that the vaccine clinic is just gonna, knock on her door and give her the vaccine and go. She had no way to understand how this works. So there are so many things that can be addressed in the Arab American community in particular.
Yeah, the multi-generational thing I think is great because a lot of times people will look at, well, there's availability everywhere or it's all over the media, but maybe people are not looking at that type of media. So being able to address different types of, like I liked how you said, the written communication, audio communication. Dr. Navarro, in your experience, what's the best way to have a vaccine conversation with people from your community?
Well, I have to say that I've been hearing Mo and Dr. Das, and I'm very impressed because I feel the empathy. I worked in Southwest Detroit before coming here to Beaumont, Troy, and I also worked in Dearborn. So the difference between that to the Hispanic population is not that far away. And I agree with your intervention regarding the respect to their opinions. Sometimes we are not going to be able to change that. But the best approach beyond trying to educate the people is to share other people's experiences with vaccination, how they went with side effects, for example, or why did they do that? And the reason why I'm saying why did they do that is because it's important for them to hear also that sometimes some patients say that I'm healthy, I never had even the flu, so why would I have the vaccination against COVID? And the best answer would be because you need to think in other people, your family, your friends, everybody who is susceptible, immunocompromised. So you got to think not only yourself, but others to get the vaccination. And believe me, it has worked. Maybe 2 to 3 people out of 10 is probably a low number, but at least some people can be convinced.
I was thinking also in general, we were talking about not forcing people, but my question is that now there's a lot of incentives for people to get vaccinated. In addition to that, there's a lot of mandates as well. So I just wanted each of your thoughts in terms of, do you think incentives are a good idea to help get people vaccinated? And then also, what are your thoughts in terms of mandates?
I think the mandates they're gonna make a subgroup of people who are contemplating the vaccination, who may be under peer pressure from their local surrounding that was stopping them from getting the vaccine. Maybe the vaccine mandate will give them that extra push to go ahead and take the vaccine. However, I don't think the vaccine mandate is going to work very effectively, and those who are either anti-vaxxers in general, who don't believe in the vaccination as a whole, or who strongly believe that the vaccines for COVID are not for them. They just don't see it.
Yeah, I think mandates have been, it's not unprecedented. I mean, especially in the healthcare institutions, we all have to get our flu shots. Before going to school, people have to get their vaccines, et cetera. But I think that the approach is basically, it sounds like we're just trying to get every angle that we can to capture as many people as possible. And is there someone that who you so badly wanted to get vaccinated and they just won't? What do you do in those situations, or what advice do you give people that so badly want a friend, a colleague, a family member to get vaccinated, and they just won't do it?
I did have that personal experience with my brother, actually, my own brother. He's 1 year older than me. He just didn't see it. It was early on in the vaccination period. He didn't want it. And I think his work mandated the vaccine in order for him to be able to do it. So he ended up taking the vaccine because of the mandate. And I think that one situation where the mandate worked very well. And I think he now reflects on it and advocates for the vaccine. He said there's a lot of things that I just got wrong, and I'm glad that eventually I did it, and then I didn't experience bad side effects, and I didn't experience the downtime that I thought I was going to experience, and I saw other family members go down with COVID, so I understand my risk better now. So I think it's just the continued conversation.
I have a childhood friend who, is not getting it and still not talking to me. It's okay. I don't, they'll eventually come around, but I'm just like, you are spending more time telling me information that is not factual for reasons to support why you don't want to get the vaccine. Oh, and guess what? He just had what? COVID. I really hope he comes around. His wife is starting to come around a little bit. So, the wife can always give a good nudge.
It's difficult. I think it's difficult. I think what you guys are all saying is that we've all had family members or friends that have not been vaccinated and who we really hope do. And I think it's just really important that we give them time and give them the resources and really work on building trust. So to wrap up, I just want to maybe just like a real brief one-liner of what you think it will take to move the needle in your community.
I think that all of us are struggling a lot, and a matter of time can tell the difference. We need to keep persuading. We need to keep strong. We need to keep believing. We need to tell people that they're the correct choices for information. This is so new for all of us. Sure, it's different than 1918 Spanish flu, but the Hispanic population likes looking for sources for what all of us here in this group can tell them, because they like hearing from people who have had the experience. As a practitioner, I would say this is a matter of time and things will get better.
I really, we need the myth busters. We need the myth buster task force. That's it.
Yeah, I agree with everything that's being said. From the Arab American community, I think it's just the people who speak their language, who come back from the same background, can make a difference, but they have to have the time, the availability, and also understand the questions and allow those questions to come in order to be able to persuade the rest of the population to take the vaccine.
Yep. So we're going to recruit all of you for our Mythbuster task force that Mo keeps harping on. But thank you guys so much for being advocates in your community. I know you've all been working on the front lines, and it's tiring to work in this pandemic, but you guys not only are taking care of patients and your family and friends and yourselves, but also advocating for your community to end this pandemic overall. So thank you guys so much again for your time. I know we've got some surges post Labor Day and all of us are busy, but thank you for spending time with us on the podcast. We also want to remind you that we have a lot of podcasts around the vaccine. We have a labor and delivery episode where we talk about risk factors for pregnant patients and people who are breastfeeding and worried about fertility. We also have an episode on misinformation to learn how to combat that. And then we have several episodes regarding the vaccine. So if you have questions and concerns, take a listen to those. Till the next time, thanks for joining us on the Beaumont House Call. We leave you today with this healthy thought. As we talk today with our guests, discuss your vaccine concerns with your trusted healthcare provider. The vaccine works. We have so much evidence that it works. Have a compassionate conversation with your family or friend, and really try to meet people where they are. And through having compassion for our community members, we can get through this pandemic.
Continue your journey to living a smarter, healthier life. Visit beaumont.org/podcast to access information and resources related to today's podcast.